God and my country.
The Intergovernmental Authority on Development, IGAD, has donated medical supplies to the Ministry of Health worth 90 million shillings. The assortment of medical supplies would be supplied to key border points of Elegu, Busia and Malaba.
And this emergency kit, Honorable Minister, is specifically meant to support IGAD member states at the ports of origin of trans-highway truck drivers, at the ports of entry in the interior countries, and also to support the communities along the trans-highway routes in IGAD region. The origin of the problem is from the ports of origin of the trucks, and therefore this fund is going to support you and your team for the next 24 months. And overall, the fund has initially started with a 60 million euro fund.
I want to take note that you have picked the right things that we need there, especially the swabs, the sanitizers, the aprons. Next time, I request that you also add the disposable gowns that the health workers wear when they are removing samples. That is very important for them to cover, especially this part, so that if people sneeze, they are well protected, as well as goggles and the face screens.
The minister cited the challenge of COVID-19 that is common among truck drivers and can be addressed at the border points before the drivers enter the country.
The points of entry at the border and also the border communities. That is where the source of infection is coming from. And want to appreciate that you took note of some of the critical areas where you identified need and have directed these supplies to. One of the borders, that is at Elegu, right now is where we are getting most of the Ugandans getting infected in their work as they go to South Sudan. Yesterday alone, we registered 12 Ugandan truck drivers testing positive. And so it is important that we protect the health workers as we identify the positive people.
IGAD is in collaboration with the Ministries of Health supporting key medical centers at international border points in all IGAD member states. The medical care supplies included personal protective equipment, medical equipment and patient care to key medical centers at international border points. Zahara Rigaba, UBC.